People from the communities we serve were getting sick and being hospitalized and dying in much larger numbers. And the reason that was happening was because of their living conditions. They live in crowded apartments, and the reason they lived in crowded apartments was because of the cost of living. It happened at the workplace. It happened, on public transport. It happened because they were not able to keep themselves safe in the same way that people who are more fortunate were able to do so. Just because vaccines are available in our clinics, it doesn't mean that everyone we want to serve will come and get vaccinated. You really have to make that effort to work with community-based organizations. You have to make that effort to work with the faith community, to work with nonprofits, to work with people and organizations that are trusted in the community itself, to be able to reach the people that you're trying to reach and to try to bring the services to them. More recently, we've done a lot of pop-up events where we've gone out to community events and offered vaccines right there just to make it easy for people to get vaccinated. So for example, at a pop-up event at a low-income housing, we would work with the community and with the housing managers, and we would bring our van and park it right outside the housing or do it in the community room. We would have our outreach workers go door to door and try to really talk to people about the vaccine, try to answer any questions that they have and encourage them to get vaccinated. And what was advantageous is we would tell them, listen, you don't need to go anywhere. We have people right here on spot ready to give you the vaccine right now. All you need to do is just walk on over and we'll be able to give you the vaccine. So being able to bring it to them, after work when people are coming home, so not just 9 to 5 on weekends and evenings, is a way to make it as easy as possible. And that's really been important. We've tried to do it in events where people are already congregating for some other reason. A lot of fairs, or yesterday we had one at a back to school event. And when people are already going to be there for a little time, you have the chance to talk to people and have those conversations, which are really critical. And then of course make it as easy as possible for them to just roll up their sleeve and get the vaccine.